My name is Lois Njambi Wagana Mureithi, a physician cardiologist working in Nyeri and Nanyuki, Kenya. I'll share with you my professional journey, which began as a student in State House Primary School, from where I moved to Moi Girls School, Nairobi, and got my KCPE. Thereafter, I joined the University of Nairobi in 1995 and pursued a bachelor's degree in medicine and surgery and completed in 2001. In 2001, I joined AIC Kijabi Hospital for my internship, after which I was posted to the Nyeri Provincial General Hospital as a medical officer. At the Nyeri Provincial General Hospital, my love for internal medicine, which was nurtured because we had many patients who had diabetes, heart disease, and hypertension. In 2004, I joined the University of Nairobi to further my education and had a master's degree in internal medicine, with which I graduated in 2008. After that, I was posted back to Nyeri Provincial Hospital to work as a provincial physician, and there I cemented my decision to join cardiology and continue with this subspecialty. In 2010-2011, I also joined the administration and worked as a medical superintendent in charge of the Nyeri Provincial General Hospital, and after that focused much more on my internal medicine. I joined the Madras Medical Mission in 2017 for a fellowship in clinical and interventional cardiology, and returned home in 2018, where since that time I have been working as a cardiologist in Nyeri in private practice. My current work involves mostly clinical cardiology, where I run a clinic in Nyeri and Nanyuki, seeing patients with all sorts of heart conditions, a lot of patients with diabetes and hypertension, which are primary conditions that feed into heart disease. I see a number of patients with valvular heart disease and a lot of patients with problems that relate to the rhythm disorders of the heart. I also do interventional cardiology work, which is based primarily in Nairobi at the Coptic Hospital, Nairobi West Hospital, and the Karen Hospital. This is because the facilities that we require for interventional cardiology work are not available in Nyeri or in Nanyuki. In 2024, I did the first dual chamber implantation in Mount Kenya region at the Outspan Hospital with a much smaller piece of equipment than what is ideal. And that was a groundbreaking or milestone achievement for us in Nyeri. I have a passion in excellence in healthcare. I believe that we should use our knowledge and our expertise to give people who come to us with various conditions the best care that they can be able to achieve. It is achievable regardless of the setting in which one finds themselves. I'm also very passionate about mentorship. I believe, like Dr. Miles Monroe said, you should die empty. The knowledge and expertise that we receive should benefit humanity even beyond our own existence. And for that reason, I'm very passionate about working with young doctors. Right now, I work with 2 young doctors full-time and 1 part-time, clinical officers, nurses, mentoring them and encouraging them to be all that they could be, to be greater even than their wildest imagination. I've also been privileged to serve in the leadership of Kenya Association of Physicians until 2024, when I was in charge of the Mount Kenya region, and in Kenya Cardiac Society, where I was serving as an executive committee member until 2025. My hobbies. I love to have time with my family, with my husband and children. We travel quite a bit with them. We enjoy walking together, so we take long walks together. I also enjoy a round of golf once in a while, and I enjoy swimming. My word to young upcoming physicians and health practitioners and health care workers of all cadres: give it your best. Take the time to acquire a skill. Learn that skill well. Learn it well enough to be able to do it or even perform it on, if your best friend required it or your relative required it. Achieve that level of skill that you have a confidence that you can be able to do it well. Don't be in a hurry to make money. The money will follow you. But be diligent, consistent, and disciplined, and the rest will follow.